Hello, this is Dr. Kuykendall, and today we are talking about solutions to anxiety, some of the science around the different approaches that we can actually start to empower you to get your life back and get out of this constant wheel of the anxious type of patterns that we have in our lives. So today we have Lucy with us, and the reason she's with us today is she has a lot of that type of symptomology. She's got the anxiety going on, and she's got some of these different symptoms. So I thought you would be a perfect match to be an archetype for what a lot of people are really struggling with out there. So a lot of young men and women, but primarily I'm seeing in the office is women are really struggling with a lot of this anxiety and the constant nervousness. And so what is this anxiety coming from? Now, a lot of people say, well, anxiety is due to not enough this or too much of that. But the reality is you're a very complex being. You have a lot of different parts and moving things. Like right now in your body, you're producing 25 trillion cells per second, which is really an amazing thing. You're producing tons and tons of heartbeats. You've got 100,000 heartbeats in a single day, pumping 63,000 miles of blood through your body. There's amazing, miraculous things happening right now. But at the end of the day, sometimes we don't actually know what's causing it. So we want to work with somebody who's a functional practitioner to look at the underlying issues. Now, before I begin, the point of this is not to cure, to treat, to diagnose, or any of those things, because the reality is in the functional approach, it's not about any of that. It's about finding what is under-functioning and needs support, like, oh, we need a little bit more nutritional support, or, oh, this is over-functioning, so we need to take some of the excess of these things in your life out, and then the body comes back into balance really nice. So that's what's really nice about this approach. And what's great is that you can also work interventionally or connected with your medical practitioner. So we want to bring all of the best in what's available in the modern world to you so you don't have to walk around with anxiety and feel terrible all the time, right? So anxiety, right? When it comes to a lot of these, we will find that people with anxiety will have blood sugar issues, or they'll have hormonal issues, or they'll have different types of symptoms. And when I was interviewing you off camera, we found out that she has heart palpitations. That's one of her biggest things. So she has this feeling of heart palpitations where you skip beats. She has a symptom of anxiety, right? Yeah. And not a whole lot of hormonal complaints, but a little bit of acne that comes up when she has that menstrual cycle that kicks in. Now, I'm saying this because a lot of you women out there, and men, except for the menstruation part, are struggling with these same types of issues. So one of the things that can really, really cause this anxious and constant feeling of something's impending doom can be, one of the many things, an autoimmune thyroid. So autoimmune thyroid, we want to talk about that today because that's one of the things you really want to rule out with whatever doctor or practitioner you're seeing. Now, it's important when you go into your doctor to have the right tests done. The standard of care in medicine is typically running the thyroid stimulating hormone, which is actually a pituitary hormone secreted by the pituitary to stimulate the thyroid hormone, right? It's thyroid stimulating hormone. So if you're only running that test and you're not running some of the free fraction hormones and the T3 uptake, you're going to miss a lot. And especially you have to run the antibodies to the thyroid, the thyroid binding globulin and the TPO and thyroid binding globulin, right? Thyroid peroxidase antibodies. So that's why when we start, the very first thing is we're going to look at symptomology. We're going to check off the boxes to see if there's other things that are causing it. But we want to look at, okay, what could else be going on? And so blood work is very nice. It's very quick. It's very socially accepted in our society. And it's what is going on directly with organs. So that's really a nice process. So symptoms of autoimmune thyroid, and this could be many other things, but can include anxiety, heart palpitation, thinning of hair, brittle nails, fatigue, exhaustion, depression, low libido, anxiety in the middle of the evening, right? Or there's 1,000,001 symptoms with it, but those are associated with many other symptoms. So testing is vital, and that's why you want to use a functional type of test where we test anywhere from 10 to 12 or more thyroid things. Above and beyond that, when you see a functional practitioner, they're also going to rule out the earlier signs of anemia, right? Anemia is a low deficiency in oxygen in the body. So looking for how your blood sugar is doing and how the oxygen levels are in the body, because if you are low on either oxygen or blood sugar, you're going to feel anxious, right? Even if you don't have an autoimmune thyroid or you don't have hormone problems, all this. So a lot of times, most of the time, that's usually the least scary scenario that's actually creating this. And so if we just give you a little bit of support in this and that, you're going to do so much better. So we want to really evaluate that. Now, there's the allopathic approach and there's the more holistic style approach. Allopathic approach, say your doctor finds out you have a hormone issue, or you have an autoimmune thyroid issue, or you have an anxiety issue. Anxiety is treated with anxiolytics, meaning they're going to give you a medication, a drug, that will make you less anxious. And there's a lot of approaches this goes through, but the side effect of that can be addiction and dependency, but also a whole other slew of side effects and symptoms. And Harvard Medical Journal itself said that if you're taking more than one pharmaceutical, the combination of the two, they actually have no way of determining the biophysiological effects on the body. And this is not to say we don't care for this approach. I just feel like as we've grown and increased in our knowledge, we need to be aware of that there's other approaches that can either be used together or a totally different direction that you can go in now. So I want the best for you. I want the best for you. I mean, I may not know some of you out there watching, but I know you, and I don't want you to fall apart and get addicted to something. There's a lot of other different ways we can go about this now. So the holistic type approach, or what they've deemed alternative, right, is, I don't really see it as alternative. I just see it as another approach that doesn't involve pharmaceuticals or surgery. If we can avoid things that are much more intensive, like if we're going to mow our lawn, we don't want to just catch it on fire or blow it up with a bomb. We can go out there with a little weed whacker and trim it up a bit. We don't have to use really heavy force. And sometimes these approaches are really stronger than is necessary for, a young woman like yourself, and you're just wanting to bounce back. So it's really all about the approach. So like I said, step one is make sure your oxygen levels are good. You can do this with a pulse oximeter, or you can see it in blood work a lot of times. But if you're getting heavy bleeding and those types of things, you don't have enough oxygen in your body because you're bleeding out liquid oxygen. If you see your fingers get blue, or the whites underneath your eyes are like not red, but they're actually really white, or you notice like you don't have the color, you should be able to push your fingernail and release your fingernail and seeing it return really quickly. With her hands are typically really cold, right? And when I push on her fingernail right now, she doesn't have a lot of perfusion. She doesn't have a lot of return on there. And I don't know if you can see it in the light. But you'll see this really common for people, and they say, yeah, my hands and extremities are always cold. Well, that's a good indicator. So taking a little bit of natural support through what you're eating in your diet, or even a little nutritional support, can be very helpful for that. Eating more on a regular set schedule and basis. If your blood sugar is all over the place, you're drinking lots of alcohol, coffee, or you just skip meals, you're in a recipe for disaster, because that didn't happen in the natural world, I get it, you're on the go, especially hairstylists, I think, are some of the most that struggle the worst, is they're constantly back to back and they're trying to make ends meet. But there's, so many different careers out there where we're going so hard, we just don't stop and eat, we forget, and our sugar does this. If you're trying to balance anxiety or even get to the root of underlying causes of autoimmune thyroid, this is a perfect example. We're not treating autoimmune thyroid. We're not treating you for a medical condition. We're just saying, man, you got to stabilize your blood sugar. There's no point in taking a medication if it's like all over the place and you drink and party and you're out all night. It doesn't make sense. So getting back to a little bit more of the science of it, is with autoimmune physiology, just any part of the body's immunology right now we're talking about, is T helper 1 and T helper 2. There's two sides of the immune system, and it's kind of like a fat kid and a skinny kid sitting on a teeter-totter. Like when you were a kid, you used to go into the playground and you ride up and down. Well, if you have always the fat kid like this and the skinny kid's up here, he's not going to like it too much. And so the imbalance in this is the immune system imbalance. And so you have two sides of the immune system. And 80% of the time, the population with autoimmune thyroid, for example, which can be a causation of anxiety and all of those things, is an imbalance in the immune system. So typically it's not actually a thyroid issue, it's an immune system issue. So instead of like forcing the immune system, a lot of doctors will give, immunosuppressants and it drops both Th1 and Th2. We want to balance the immune system, and it comes back to balance. And there's very easy ways to do that, one of which is eliminating certain foods from your diet. If you're eating foods that are basically thyroid blocking foods, and they will literally block the function of that thyroid, and we can go into that another video. Or if we give you a certain type of nutrition or herb, you can balance that out versus immunosuppressing, right? So it's important to know when I have a patient come in and we suspect autoimmune thyroid, even if the blood work shows it's okay, because a lot of the blood work will show what's called a false negative. If you walk like a chicken and cluck like a chicken, you're probably a chicken. So what we want to do is say, okay, I usually tell people, okay, what we want to do, other than essential medications that your medical doctor is doing, we tell you, let's back off of all these supplements. People come in with bags and bags of supplements. Let's back off of that stuff, and let's just reduce it down to the simple and the basics, which I'll explain to you in a minute, which typically it could look like for some people, right? So if you're taking lots of herbs and you're taking mushrooms like reishi and cordyceps and ashwagandha as far as an herb, and you're taking, all types of things, cat's claw and golden seal and goldenrod and all the things, your immune system is being affected by those beautiful herbs, those beautiful mushrooms that grow on our planet, and it's causing a stimulation of Th1 and Th2. And if you don't know which side the fat kid and the skinny kid are, you're causing all the symptomatology, and all that imbalance causes anxiety, and you feel terrible and you feel tired and you feel stuck and lost and depressed. And we don't want you to go that route. So we take all that stuff out and then we simplify. And what I like to do, and this is not everybody, because across the board, when we run blood testing, we find out what your vitamin D, or what's called cholecalciferol, vitamin D3 on your blood, your blood test. If it shows low, and usually 30 or below in the medical ranges, I like around 50 to 80, for a pretty good balance as far as your vitamin D3. If it shows low, then, vitamin D is wonderful for a lot of things. You can look it up. But D especially is great for immune system balancing. It will help that teeter-totter, that Th1 and Th2 basically imbalance, start to balance out again. So I like vitamin D. I really like utilizing fish oil or some really good essential fatty acid. That also causes that balance to bring back to neutral. And so also glutathione. Now glutathione is a fantastic thing because it's one of the 3 primary ways that your liver actually detoxifies. It's called methyluronidation, glucuronidation, and sulfuronidation. There's 3 pathways. We don't need to get super duper technical right now, but with glutathione, it balances the immune system, and it also helps your liver detoxify, because a lot of the things going on in the body, just like a river, when it gets kind of built up and there's lots of leaves and stuff in the river, it can get stuck at the rocks. You just clear that out with a stick, and the river will naturally just eliminate. You're a filter, and everything you eat, drink, and think goes through your body's filter. Whether you believe it or not, you're a filter. So if we allow the filter to start to clear with things like glutathione and even B vitamins, man, you'll start to have less and less symptoms, and that would be good, right? Yeah. Okay, good. So basically, vitamin D, fish oil, glutathione, and one other really fantastic thing is L-glutamine. L-glutamine is really good for the gastrointestinal system. You hear a lot of practitioners online talking about it, but it really helps heal all the little cilia and all the gap junctions that make up the intestines. It helps to put the glue together in there and allows it to be less permeable, less penetrable. Because if you're basically have an intestine, right? It's like a lumen, right? You've got this running all throughout the body, and in these gap junctions, if there's inflammation, which behind hypothyroidism, behind autoimmune thyroid, which is called thyroiditis or autoimmune Hashimotos thyroiditis, is inflammation. That's what itis means. So if there's this inflammation in here, we want to make these gap junctions, the intestinal junctions, come back together. When you do, using something like L-glutamine, which is a product you can get online, and you can talk with your doctor about dosing and those types of things, but when you take those types of things, it makes your intestines less permeable, right? Permeability is a big reason why a lot of people are having the epigenetic spark, the thing that causes this whole thing to start to unfold. There's some reason that you have anxiety. There's some reason, if it's, God forbid, autoimmune thyroid, there's a reason it starts. And they're finding that epigenetics, which is it's the rock in your shoe that finally just causes it to be like, okay, that's it. I can't walk anymore. My foot is killing me. There's a reason behind that. And so if we get to the core of it, we don't have to treat your disease. We just say, take the rock out of your shoe, man. It's like, oh, right? Wouldn't that be nice? Just take a rock out of your shoe and it'd be better. So now what we want to get into is some of the other things that will help support if there is anxiety or if there's an underlying causation like autoimmune thyroid, since we started talking about that with you today. Since a lot of your symptoms can be that. That's why blood tests is so important. That's why these other types of testing are so important, because knowledge is key. If you don't have enough knowledge about what's causing it, then good luck. It's like trying to find your way out of a dark room without any type of light. It's a lot easier if you just turn the lights on, and that is what's really helpful about this. So the next thing is water, right? We want lots of good water. Your body is made up of water. 80% of the body is water, just like planet Earth. We want minerals, because minerals are what make you electrical. If you're trying to do any of this stuff, if you take your car in an auto mechanic and say, hey, there's something wrong with the car, but the guy's like, are you putting water in the radiator? You're like, no, I don't do that. I'm not really into putting water into radiators. And, well, do you put unleaded gasoline? He's like, nah, I'm kind of more of a diesel kind of guy. And you're like, I don't know what I can tell you about your car, sir. It just doesn't work like that. So a lot of people come into the office and I'm like, man, water, minerals, and essential fatty acids. Essentials are the essentials to life. You can't live very long or produce any of your hormone pathways without essential fatty acids. So we really want to do those three things. Those are powerful for autoimmune stuff and just anxiety across the board. And these are very general, gentle things, okay? Next, we want to get into dietary. People say, well, what do you like to eat? Are you vegan? Are you this? Are you that? I let people battle it out online. It's totally fine, however you want to go. But the main thing at the end of the day is stabilize that blood sugar. If it's doing this, it's going to be a problem. And when people come in and they're really weak and they're having severe anxiety, and it can get bad. I used to be sitting at the hospital until I couldn't live anymore. I thought I was going to die. My heart's pounding. I can't breathe. And I would finally crawl out of my car and, very embarrassingly go into the hospital, and they would give me oxygen and tell me everything was okay. You wouldn't talk about a desperate feeling, like, wow. So it can get really severe. So when we go through and we start saying stabilize blood sugar, that's step one. We're not even treating anything right now. We're just saying you got to eat more frequently. And what I like for the most part of people is more of a paleo type diet, which is vegetable based, some good fats, good fats in your diet, and some good protein. So you don't need to be eating like an Atkins diet where you're eating lots and lots of protein, but usually about a deca card size or the palm of your hand kind of size. You can go even less. Some people don't like to eat a lot of animal protein. I totally get it. I totally respect it and understand the many, many reasons why. But when you're struggling and you're really not feeling well, it's easier to stabilize with better protein and fat. And so if you can do it without animal protein, I say more power to you, but I find that people struggle unless they really know what they're doing with food. So paleo type diet, and then we really want to look at the things that we're putting in the river that don't need to be in there. Like if you've got a river that's not flowing because it's blocked, you don't want to throw more stuff in there. You want to get the stuff out. So we eliminate all those supplements, right? And we simplify, and you really need to work with a practitioner that understands this, or don't try this on your own, right? But we want to eliminate the overload. So a lot of times we're eating too many jelly donuts. We're eating too much bread. We're eating too much pasta. The gluten, unfortunately, this whole gluten thing, that is not a fat. It's a real thing. It's a protein, right, that is made up of gliadin, which is the protein inside of gluten. It's causing another type of stressor. It's a Th1, immune system, stressor. So it's pushing your immune system to actually attack more. And autoimmune thyroid is an attack against your own body's tissue. Autoimmune disease can show up as MS, which is the brain and electrical system, right? It can show up in the joints like rheumatoid. It can show up in other tissues like lupus. There's many, many different types of autoimmune diseases. And this general approach of taking things out, reducing, and balancing just very gently nutritionally without tons of herbs or things that are stressful can help a lot of autoimmune type patients. And this is how I was able to support so many of you and your families through this healing process. Because if you understand this concept, you can apply it to a lot of things. It's just as simple. It's really a simple concept. Try it for yourself. You'll see. And then the protein in dairy a lot of times can be very, very troublesome for people. So I find the gluten in the dairies, unfortunately, are some of the biggest causations of the epigenetic spark and the thing that's pushing the immune system. And it causes chronic inflammation. Eliminate it for yourself and you may find, wow, this has really helped. Now, if you eliminate these and you don't see a big improvement, what it means is that it's not the end-all, be-all. It's not the cause, not the issue. Your issue is going to be different than of so many people. So that's why we want to be intelligent about this and look at the approach in a very wide, viewing scope. So autoimmune thyroid, God forbid it is the way I look at it is an immune system attack here. And if you widen back a little bit, what is that? It's rejection of an organ, of a system, of a nerve. And here it's rejection of self. Autoimmune thyroid is rejecting the thyroid, and so your immune system's attacking it. If you're eating badly, poorly, like gluten and dairy, and you're eating lots of sugar, you're going to improve or intensify the inflammation. You're going to attack your body more, and it causes more damage. So that's the importance of eliminating that stuff. So we want to calm your system down. We want to calm your nervous system. And there's many ways of doing that. There's a lot of great videos out here on Psyche Truth. So there's a lot of options for you to look into of like, what can I do to calm my nervous system? And because Harvard even says, the medical journal, again, 80% or more of all health issues are stress related. So we got to get your stress down. If you're trying to do all this and you just are not enjoying your life, there's really no point. That is another form of rejecting yourself. So I really truly believe with all things that there's adjuncts and there's a way to work in a complementary fashion between your natural and your medical practitioner. And you're seeing a lot of medical practitioners getting more complementary, or meaning more inclusive, more alternative, which I don't really feel is a true answer. Like, it's not an alternative. It's just another option that exists. It's not alternative to what, Combine these for yourself, look into this stuff, and you will find that you actually bounce back much, much faster. Sometimes people do really well with an herb or a glandular or a homeopathic. Sometimes people do well with a little bit of T3 or a compounded, product. Everybody is bioavailably different and they're not all identical to one another. So we're all different that way. So this will allow you to really get more empowered in your life, be a better mother, a better daughter, a better, student, and go out and help the world, because at the end of the day, that's what you're looking for. And I know it's helped myself, it's helped thousands of patients, and I really know that it'll help you if you start to look into this more. And I really invite you to tune in to some of our next videos that we'll have coming out. I'm excited to be here and assisting you take back your life and just allow you to be more empowered. Thanks for tuning in.